Hello to all. We will speak about the renal blood flow as a complete explanation for what? For the lecture which has started the introduction about anatomical and histological considerations about the kidney. So the renal blood flow. We have to take into our minds that the kidney receives about 1.2 to 1.3 liters of blood in each 1 minute. 1 to 1.3 liters of blood in each 1 minute. So this is a very large amount of blood which can be delivered to an organ in the body other than other organs of the body. So why the kidney receives that large amount of blood each 1 minute? Of course, this amount of blood is not the required amount for the kidney for its normal functions, for its own demands, like nutrition supplement or oxygen supplement. So instead, the large amount of blood which is delivered or provided for kidney in each 1 minute in order to maintain the process of filtration of blood. So the kidney is provided by large amount of blood in order for what? To perform its own primary function, which is filtration of blood, to get rid of the waste products from the blood and to reabsorb the normal important ions. So the renal blood flow is being determined by two factors. Those are the difference between arterial and venal renal pressures and the total renal resistance. So the renal blood flow can be determined by renal arterial pressure minus renal venous pressure divided by renal resistance. The renal arterial pressure is about equal to the systemic pressure, while the renal venous pressure about 3 to 4 millimeter mercury. While what about the renal resistance? Renal resistance means many factors that regulate or control or affect the total resistance of the arteriolic system bed inside the kidney. Of these factors is number one, sympathetic stimulation. You know that the renal arteriolic bed and especially the renal afferent and efferent arterioles are innervated by sympathetic nerve endings. And these sympathetic stimulations or nerve endings will cause what? Will cause vasoconstriction of the arterioles, of the glomeruli of the kidney. So the vasoconstriction of the glomeruli, of the arterioles of the glomeruli will affect the glomerular filtration rate and reabsorption. So this is the first factor. The second factor is hormones. As you know, there is a gland or specific gland which is called adrenal gland. Adrenal gland locates or situates over the kidney. Each one kidney has an adrenal gland situated over which. So the adrenal gland medulla secretes the hormones, the adrenaline and noradrenaline, or the catecholamines. These hormones also affect the renal arteriolic bed and cause vasoconstriction. The third factor which causes vasoconstriction of the renal arteriolic bed is endothelin. Endothelin is a specific hormone, can be considered as a hormone, which is secreted by any vascular bed within the body when there is a trauma, to that specific arteriolic bed. For example, in case of poisons, in case of toxemia, or whatever. So when there is trauma to the endothelial wall of the arteries, there will be secreted the endothelin. Endothelin is a strong vasoconstrictor. Okay. On other side, there are many factors, which cause dilation of the arteriolic bed within the kidney, specific the afferent arteriole. The afferent arteriole is being dilated by prostaglandins and by nitric oxide. So prostaglandins and nitric oxide can cause dilation of the afferent arterioles of the glomeruli of the kidney. And the most important one is the nitric oxide. So these two factors make what? Make the afferent arterioles liberated from the vasoconstriction action of sympathetic innervation, which we have mentioned before. So why is that? Because the afferent arteriole needs to be always dilated in order to permit for normal glomerular flow, to permit what? To permit and allow for persistence normal glomerular filtration rate. So at any case, for example, in some diseases, using of some drugs that affect on nitric oxide formation by endothelium of afferent arterioles or other arterioles. So this will lead to what? Will lead to make the afferent arterioles of the glomeruli to be under control of sympathetic innervations only. And this will cause vasoconstriction of the arterioles of the glomeruli, and then the glomerular filtration rate will be affected, and also this will cause what? Will cause not normal filtration of the blood, and may affect also the blood pressure itself. Another important factor that affects the renal blood flow and the glomerular filtration is the renin angiotensin system. So first of all, we have to speak about renin.